the least teratogenic drug. AFB, hepatic CA या hepatoma. VMA, that is vinyl mandelic acid, pheochromocytoma. Which of the following is associated with heparin when stops? The answer is propagation of thrombus. Because clot is already formed, and when you stop heparin, there will be propagation. The thrombolytics dissolve the clot. The heparin prevents the propagation of clot. The antiplatelet inhibit the platelet aggregation. A lady presented with pervaginal bleeding, history of bleeding disorder, and having dead fetus. Now, having dead fetus, the best initial is evacuation of the uterus. Remove the uterus before the patient goes into the DIC. Remove the dead fetus, because if a person is having bleeding disorder and goes to the DIC, it is fatal. Lady presented with yellowish discharge, that is the answer is trichomoniasis. Yellowish to green discharge, trichomoniasis. Coming next. Now this MCQ is the wrong. Streptococcus pneumonia. Now I will give a little overview of this. We are having catalase enzyme. First catalase. So catalase positive and catalase negative. The catalase positive includes the Staph aureus, the staphylococci. The catalase negative includes the streptococci. I am giving a short overview so that you don't miss any MCQ in the future. So catalase positive mean staphylococci and catalase negative mean streptococci. So we get the MCQ over here, that is the catalase negative. Streptococcus pneumonia is catalase negative. So in the catalase positive we are having staphylococci. Now coming toward the staphylococci. Staphylococci is further divided into two, the coagulase positive and coagulase negative. One is the coagulase positive and coagulase negative. The coagulase positive include the Staph aureus. Coagulase positive include the Staph aureus. Coagulase negative include other staphylococci, such as other staphylococci. Staphylo, not the strepto. So Staph aureus lies in the coagulase positive, while the coagulase negative include the other species of staphylococci. Now coming toward the catalase negative. In the catalase negative we are having group A, B and C. Group A, B and C. So the answer over here is, the right answer is missing. Catalase negative. The answer is catalase negative, and it produces the green colonies, not brown colonies, green colonies. So I think you have to get the concept as well. In breast, development alveoli and lobules growth by which hormone? Now the answer over here is progesterone. Now I will add another MCQ. The ductal system is developed by estrogen. The alveoli and lobule by progesterone. The other is fats deposition in the breast is by estrogen. The other is conducting system of the breast is by conducting estrogen. Parenchymal system of the breast is made by progesterone. During pregnancy there is no lactation because of the inhibitory action of both estrogen and progesterone. If both is missing, then the answer is estrogen. Women with microcytic hypochromic anemia, investigation of choice is ferritin. Investigation of choice is ferritin. Now if there is another MCQ related to it, a patient is having microcytic hypochromic anemia but ferritin is 150. 150 ferritin means normal ferritin. So it means patient is having thalassemia. If thalassemia is not in the option, the another possibility is sideroblastic anemia. In sideroblastic anemia, ferritin is normal or high. Side effect of IUCD, purulent discharge. That shows infection. Which of the following is which is herpes simplex virus type 2? That is cervical CA. Here option is endocervical carcinoma, not endometrial. For endometrial, the two most common causes are diabetes, hypertension, hypertension, diabetes, diabetes, hypertension. Endometrium showing increased vascularity, start of the appearance of glands and vacuolation. This is secretory phase. Secretory phase. Which of the following is associated with the itching sensation? The dorsal column is for highly developed sensation. The spinothalamic is for, this is actually the lateral spinothalamic tract, that is for crude touch, crude sensation, lateral spinothalamic tract. So the answer over here is B, not A. A is associated with the fine touch, 2-point discrimination, vibration. Pap smear comes in which category? Now pap smear is the screening test, and the screening test comes under secondary prevention because it helps in the early diagnosis and treatment. So there is another MCQ. You do something to prevent the emergence, to prevent the formation of risk factor. Avoidance of formation of risk factor mean primordial prevention. Primordial prevention mean you do something so that the risk factors do not develop. Like for example, say a patient is having thalassemia. Risk factor for thalassemia is cousin marriages. So you avoid cousin marriages. The cousin marriages are avoided. So you have avoided the risk factors for the development of a disease, that is thalassemia. So that is primordial. Primary prevention mean you are at risk, but you have not yet developed the disease and you are doing something. Like for example, a patient is having family history of coronary heart disease and he is using Loprin. A patient is having history of stroke and he is using Loprin. So yet he has not developed the disease, but he is at risk. So he uses Loprin to prevent the disease. This is primary prevention. Secondary prevention mean early diagnosis and treatment. And the secondary prevention mean a person is having a disease. Like for example, say a person is having stroke and now he is taking Loprin to prevent another stroke. This is secondary prevention. And the tertiary prevention means the person is disabled, the person is having complication of disease, and you do something to rehabilitate. So the rehabilitation lies in the tertiary prevention, rehabilitation. So coming next, true about lignocaine, already discussed. This is the wrong answer, that overdose is managed by IV cortisone. I have given the full concept. If there is MCQ like this, true about lignocaine, and the option is given, then yes, the A is right option, maybe, because it causes vasovagal syncope, it causes hypotension. So supportive management. Coming next, spinal anesthesia. Now you have given spinal anesthesia to a patient and the patient pain is not relieved and need more analgesia during delivery. So you are going to block the pudendal nerve. You have given the spinal anesthesia and the patient is still complaining of pain. Of course the pain is coming from the uterus and the cervical region. So you give pudendal block. So that is S2, S3, S4. S2, S3, S4. The right answer over here is missing the pudendal nerve. A is wrong option. Or you can there will be another, they can twist the MCQ. At which area you should give analgesia? That is ischial spine, around the ischial spine, because the nerve, the pudendal nerve take a turn around the ischial spine. Coming next, sphincter urethra is supplied by pudendal nerve. Disc now absent knee jerk. It causes all except knee jerk is caused by L3, L4. L3, L4. Baby having abnormal leakage of urine on examination of urethra. Now, if this is the penis, so this is the ventral side. So on the ventral side you are having, hypospadia, and on the dorsal side you are having epispadia. So dorsal epi, ventral hypospadia. Coming next, needle inserted into scrotum do not pierce tunica albuginea because it lies viscerally, more viscerally. So if you enter the scrotum only and you have not pierced the testes, then tunica albuginea. But if the question says you have pierced the scrotum and you have pierced also, you are into the testes, then the answer is none of the above, because you have already pierced the tunica albuginea. Tunica albuginea is the covering of the testes, and then there are some layers, and then there is the scrotum. So if you enter into the scrotum, the tunica albuginea is paired. After cholecystectomy, that is the right subhepatic space, and that is the most common site for collection. So regarding the collection, there will be MCQs coming regarding that. So regarding breast, all are true except start to develop before puberty, axillary lymphatics are main, and pectoralis fascia. These all three are right option, because the breast development starts even before birth. But if the question says the glandular development of breast, glandular maturation, then yes, that starts at the puberty. But over here, all the three options are right. Start to develop before puberty, yes, that is actually before puberty, and that is actually before birth. BC also right. But if these three options are given and there is no other option, then the correct answer over here is option A. So coming next, true regarding semen, the answer is bulk is formed by seminal fluid, that is 60%, and 20% by prostate. Artery damage in removing ovary from ovarian fossa, that is internal iliac artery. Which of the following is associated with the sacroiliac gland? Discussed in the detail this MCQ in my first video. If there were 5 options and I exclude all of them, there was one option, that was fibrous gland. That was the right answer. If you haven't watched my first video, go quickly to that portion. But over here the right option is plain synovial gland. Female with hysterectomy, with pain and retention of urine. So the answer over here is ligation of ureter. The ureter is ligated. Ligation of ureter. Bladder base is formed by, the answer is posterior surface. And the bladder base has which area? Special area, that is called trigone. Subarachnoid space ends at S2 is the right answer over here. Coming next, mode of action of local anesthetic, blocking of sodium channel. Pressure of oxygen at sea level. Now I will clear this MCQ. Now pressure of oxygen at sea level. At sea level, the total pressure is 730, and the oxygen concentration is 21%. So 21% of 730 means 721 divided by 100 into 730. So divide this by this, and 2.1 into 73. Do this multiplication. Whatever the answer comes, that will be the right answer in the exam. But if the question asks pressure of oxygen at sea level and they are asking about saturation, then the answer is 97%. And the answer over here is 97%. So keep in mind the other calculation also. Coming next, lady diagnosed as a case of hyperthyroid, treatment and pregnancy. Now if they have given you a trimester, and first trimester of choice is propylthiouracil, of second and third methimazole, references USMLE, up to date and embossed. If they have not given trimester wise, then the answer is choose the most safe, that is propylthiouracil. What is the most common complication of propylthiouracil? Hepatotoxicity, hepatitis. Female diabetic in pregnancy should be given insulin treatment. The substance involved in the transfer of one carbon fragment to the other is biotin. If the biotin is missing, the next best option is tetrahydrofolate, that is folic acid. Something about non-essential amino acids. So focus on the word amino acid and fatty acid. We have discussed the essential amino acid. That were 2, linoleic acid and linolenic acid, that is omega-3 and omega-6 fatty acid. Over here they are talking about amino acid, so alanine, non-essential amino acid, other are essential, arginine, lysine and isoleucine. Regarding suprarenal gland, simple superior border, it lies on the superior border of the kidney, roof of the kidney. Hormone involved in uncoupling of steroid phosphorylation. Now over here I will give some other MCQ regarding the thermogenesis. What is the most common thermogenesis? endothermic thermogenesis. Now every word of mine is a MCQ. What is the most common thermogenesis in a human body? That is endothermic thermogenesis. In which organ there is endothermic thermogenesis? Virtually all organs, most of the organs. Which hormone is responsible for endothermic thermogenesis? The answer is thyroxine. Coming next, cold induced shivering thermogenesis. Cold induced shivering thermogenesis take place where? Skeletal muscle. Answer is skeletal muscle. Cold induced shivering thermogenesis. Which neurotransmitter or hormone is involved? The answer is acetylcholine. The answer is acetylcholine. That is cold induced shivering thermogenesis. Coming toward next MCQ. Cold induced non-shivering thermogenesis, in which there is no shivering. Cold induced non-shivering thermogenesis, that is caused by norepinephrine. Next MCQ is cold induced non-shivering thermogenesis mostly take place in infants, neonates, children, and take place in which fats? Answer is brown fats. And take place in which organ? The answer is brown fats. And take place in which portion of the body? The answer is brown fats. Well, I have shared the reference of this on my Facebook page by the name of FCPS Part First in Clinical by Dr. Jangir. So over here, cold induced non-shivering thermogenesis, the mechanism is uncoupling of oxidative phosphorylation. Normally the oxidative phosphorylation is coupled, in which in every step there is production of ATP, but there is uncoupling. Uncoupling means there is no formation of ATP, and all the energy is used as a heat. Pharmacist checking efficacy of a drug, selected a group and then randomly selects people. Method involved is, the answer is randomized sampling. So over here the option is random selection, A. Coming next, factors least involved in the doubling stage of carcinoma. What is the right answer? Exfoliation. That is, the exfoliation is the correct answer. That is missing. It is not interleukin 1, 6, TNF, interleukin 9. Exfoliation. If there is TNF inhibitor, that is the right answer. But the correct answer is missing, exfoliation. More in mother milk as compared to cow milk, the answer is lactose. And the mother milk is deficient in, that is pantothenic acid. This is Chatterjee MCQ, Chatterjee. If the pantothenic acid is not in the option, the next option is iron. Percentage given should be plotted on pie chart. Right option, true about bupivacaine, longest local anesthetic. Regarding atmospheric concentration of nitrous oxide in OT room. Now if they ask about per 24 hour, the answer is 100. If they ask about in 8 hour, the answer is 25. But if the timing is not mentioned per day or per 8 hours, focus on the stem in exam. This is the most wrong thing we do in the exam. We have preoccupied our mind with the wrong answers. So come out from that, manipulate learning. So per day 100, in 8 hours 25. If per day or per 8 hour is not mentioned, answer is 100 parts per million. Patient presented with abdominal pain, ultrasound showed some fluid-filled space in the pancreas. Serum lipase. What is the most sensitive? Serum amylase is sensitive. It means if it is negative, it is good. If it is positive, means nothing. What is the most specific? That is serum lipase. It means if it is positive, there is pancreatitis. But if it is negative, negative test does not exclude pancreatitis. Positive amylase always does not include pancreatitis because that is more sensitive. Sensitivity means if it is negative, it is good. If it is positive, it does not include include pancreatitis. Specificity is good if the test is positive. If it is positive, it means it is true positive and this is disease. If it is negative, it does not necessarily exclude the disease. Sensitivity, spin, it rules in the disease. Sensitivity. Specificity is spout, it rules out the disease. Patient exposed to the diethyl stilbestrol, already discussed in my previous slide, that is clear cell carcinoma of vagina in the baby later in life. Ascorbic acid, that is collagen synthesis. Patient with HBs antigen, anti-HBs antibody negative and IgM positive. The answer is acute hepatitis. Acute hepatitis. Now there is another MCQ on this. A patient is having only IgM positive. All other things are negative. What is this? Only IgM positive. This is Vendo period. This is Vendo period. So this concludes the end of the fourth paper. So if there is any confusion, or if you think I have made any mistakes, you can give your opinion, your suggestion, your complaints right down in the comments. Thanks for watching.